cases today, 2 of them in Táchira state that have no relation to recently arrived migrants, and 8 new cases in Mombasa state, which are part of the outbreak detected at Baseball Academy.
Brazil's newly appointed health minister pushes for an exit strategy while governors want to maintain the lockdown.
Spain 255.
In order to protect our great American
And
workers,
Trump
I
has
just
signed an
an
order to
executive
halt
order
immigration to the U.S. for 60 days.
into the United States. This will ensure that.
Hello and welcome to Telesur English. I am Estefania Bravo in Quito, Ecuador. This is from the south. Venezuelan President Nicolás Maduro informed of 10 new cases of the novel coronavirus. Let's have a look.
We had 10 new cases today, 2 of them in Táchira state that had no relation to recently arrived migrants, and 8 new cases in Mombasa state, which are part of the outbreak detected at the Baseball Academy.
Maduro announced that the total cases has raised to 298 in the country and a recovery figure of 41% from the total cases.
With these numbers, Venezuela has reached 298 total cases, from 41% have recovered. 85 people remain hospitalized, 27 of them in private clinics, and we still stand at 10 deaths.
President Maduro also spoke about the critical economic situation currently gripping various nations across the world, including the U.S.
We need to consider unemployment numbers in the United States. There's been almost 30 million people left without a job over the last 15 days. In Spain, there are projections of unemployment rate climbing past 20%. It's the same across the world, and it's a situation made worse by the pandemic.
Moving on, Brazil's newly appointed health minister says his team is working to design an exit strategy for social distancing measures imposed by local governments. This comes after far-right President Jair Bolsonaro has continuously demanded that governors lift quarantine measures and called on his supporters to return to work, referring to the pandemic as, quote, a little flu.
If you analyze deaths per million people, the number in Brazil is 8.17. Germany has 15. Italy has 135. Spain 255. United Kingdom 90. USA 29. Our number is one of the best. Social distancing is an absolutely natural and logical measure at the start, but it cannot be without an exit strategy. That's what we are going to develop, and that's what we are going to do to support the states and municipalities.
A mass burial of COVID-19 victims took place on Wednesday in the capital of Brazil's Amazonas state, Manaus. Aerial images show the burial taking place at the Nossa Senhora Aparecida cemetery days after excavators dug the common grave. Relatives and friends of some of the deceased were also present to pay their last respects to their loved ones. According to local authorities, the number of burials since the pandemic started has gone from 30 to 100 per day. Manaus has so far confirmed almost 2,000 cases of the disease and 172 deaths. Brazilian media reports that President Jair Bolsonaro has been trying to sabotage left-wing governors in their attempts to fight the COVID-19 pandemic, and that Bolsonaro has been trying to block shipments of medical supplies. More on this in this report by our correspondent Brian Muir.
8 of the states in Brazil's northeast region are governed by governors from left-wing political parties. And one of the most popular governors in Brazil right now is Brazilian Communist Party Governor Flávio Dino in Maranhão. Now, the governors in the northeastern states have banded together to try and work collaboratively to best respond to the coronavirus pandemic. And they've been fighting back against far-right President Jair Bolsonaro every step of the way. Bolsonaro has not just repeatedly called for an end to quarantine orders, which is being ignored by all of these governors. He's also tried to sabotage shipments of medical supplies, medicines, and ventilators to the governors in the northeastern states. So last week, after repeated attempts at getting ventilators into his state, Governor Dino smuggled 107 ventilators in from China, bypassing both United States government attempts to capture and sabotage the shipment and attempts by Bolsonaro to block ventilators from arriving in the Northeast. And today there was another victory for Governor Dino. The Supreme Court ruled that a company in Santa Catarina has to deliver 68 ventilators to Maranhão State within 48 hours. This is a shipment that was blocked by direct order from President Bolsonaro. So once again, as Bolsonaro tries to sabotage the governor's attempts to minimize transmission of the deadly coronavirus, which has already claimed over 1,700 lives officially in Brazil, the governors keep fighting back every step of the way and represent the only chance right now of Brazil's citizens to protect themselves against this deadly killer.
We thank Brian Muir for that report. More stories coming up. Don't go away. Welcome back to From the South. Cuba has sent a medical team to Cape Verde to assist the African nation in the fight against COVID-19. 5 doctors, 10 nurses, and 5 specialists in hygiene and epidemiology left for Praia on Wednesday. Cabo's Minister of Health assured that the government has made preparations for the team's arrival. The country has so far reported 68 positive cases and 1 fatality.
To represent Cuba in these moments in which it's offering its support, as always, in accordance with the beliefs of José Martí that homeland means humanity, and we fulfill this will, we are helping the world and guarantee with our actions things that cannot be done in other places. We are also sure that our families are well cared by the revolution and the Cuban health system.
Grenada is among the 20 countries around the world where Cuba has sent medical missions to help combat the pandemic. However, a U.S. blockade has been preventing many of these countries, especially in the Caribbean, from accessing medical supplies. We spoke to Dr. Darj Maya Lepkis, a member of the Cuban mission in Grenada, about this.
The restriction in all the world is for everybody, not only for Cuba or Grenada or China or UK. But however, we working with what we have here in Grenada. We have all the necessary supply to help and give medical treatment for all the people that have COVID-19 or for the prevention, because prevention is the most important to prevent the spread of the COVID-19. Basically, here in Grenada, we have the necessary resource, not everything that we want to have, but we have the necessary, and the ministry and the government, he give to us all the support and everything that what we need to prevent the spread of the COVID-19. Currently here in Grenada, we don't have too much people sick. The spread is low, but we're working together with the ministry and the government and the population to prevent that become more seriously.
The number of COVID-19 cases in Ecuador has now passed 10,000, while the government is set to announce new economic measures to mitigate the impact of the pandemic. Our correspondent, Denise Herrera, in Quito, has the details.
In a virtual press conference, the Ecuadorian authorities informed that Ecuador has now 10,850 cases of COVID-19, and now Ecuador has 537 deaths. The main point in this health crisis now is the economic situation. Actually, 2 commissions of the National Assembly are discussing the 2 projects of economic reforms made by President Lenin Moreno. Most of the Assembly members of the National Assembly are rejecting these economic reforms. They said that these laws will affect all Ecuadorian citizens. In this context, the Health Minister of Ecuador, Juan Carlos Ceballos, just talked, and he said that the government is taking all the preventive measures in all the hospitals of Quito and the country to prevent prevent the spread of the COVID-19. But as we know, the complaints made by the health sectors, the professionals of the health sectors, are still denouncing that they need the health equipment to face in the first line this pandemic in the country. As we know also, these two commissions who are discussing the economic reform will give their response in the coming days.
We thank our correspondent, Denise Herrera, for that report. Latin America and the Caribbean is set to experience the worst recession in recorded history as a result of COVID-19. The International Labour Organization says the region will see a fall in GDP of 5.3% in 2020 due to the pandemic. Additionally, 61% of Latinos working in the United States have lost their jobs or part of their salaries, according to a study by the Pew Research Center. The head of the UNs World Food Program is warning that as the world is dealing with COVID-19, it is also, quote, on the brink of a hunger pandemic, adding that even before it became a global issue, the WFP had warned world leaders that 2020 would see the worst humanitarian crisis since World War II.
This might sound truly shocking, but let me give you just some numbers. 821 million people go to bed hungry every night all over the world, chronically hungry. And as Dr. Chu just pointed out, as the new global report on food crisis that's published today shows, there are a further 135 million people facing crisis levels of hunger or worse. That means 135 million people on Earth are marching toward the brink of starvation. But now the World Food Program analysis shows also, due to the coronavirus, that an additional 130 million people could be pushed to the brink of starvation by the end of 2020. That's a total of 265 million people. In a worst case scenario, we could be looking at famine in about 36 countries. And in fact, 10 of these countries, we already have more than 1 million people per country who are on the verge of starvation.
The famous Les Luthiers band in Argentina has lost another one of its founding members, Marcos Munstock. The 77-year-old Munstock died after battling with cancer for over a year. He was the third member of the original cast to pass away. Munstock was an actor, he was a screenwriter, and a musician. His most famous character was Johann Sebastian Mastropiero, a composer who wrote the humor and musical pieces of Les Luthiers. Ethiopia Airlines, the biggest in Africa, is facing a $0.5 billion loss in revenue amid the global crisis.
All kinds of problems that Africa has suffered, we have always stood with Africa. We have never abandoned Africa in bad times. Will we be able to sustain with only 15% of our revenue, because cargo constitutes only 15% of revenue? For a short period of time, yes. But for how long? Very difficult to predict.
In Kenya, the government has placed a lockdown on Mombasa County following an escalation of community spread of the coronavirus. Confirmed cases now stand at 304 after 7 nationals tested positive in the last 24 hours. Interior Minister Fred Matiang'i said apart from a local shutdown, the government has locked the country's borders for an initial 21 days. The National Command Center on the coronavirus pandemic has also been ordered to review and strengthen the enforcement of public health measures in the counties of Mombasa, Kwale, and Kilifi. We're taking one last break, but stay with us.
A review of the world news that investigates, incites analysis, and induces criticism, because every event has a context.
Pusimos el punto en ahí.
Dot in the eye. Saturdays, only on Venezuela.
Welcome back. U.S. President Donald Trump has signed an order partially suspending immigration to the United States, arguing that drastic measures would protect jobs during the coronavirus crisis. The suspension hits people applying for permanent residency or green cards. Seasonal workers such as immigrants vital to U.S. farm labor are still allowed to enter.
In order to protect our great American workers, I've just signed an executive order temporarily suspending immigration into the United States. This will ensure that unemployed Americans of all backgrounds will be first in line for jobs as our economy reopens. Crucially, it will also preserve our healthcare resources for American patients. We have to take care of our patients. We have to take care of our great American workers. And that's what we're doing. So I've just signed it just before coming into the room.
Women are at the helm of fighting COVID-19, and it's not just that women do most of the essential jobs, but having nearly half of the world's children home from school means that many mothers are trying to teach, caretake, and manage their workload simultaneously. Here's our correspondent Jorge Gestoso from Washington, D.C. with more.
Women are doing most of the jobs during this pandemic. Most of the jobs that they do are considered essentials, and therefore they cannot stay at home and just keeping the social distances. Most of them are really attached with staffing with the hospitals, and therefore studies shows that 1 in every 3 women are doing a job that is considered essential, and in the case of the hospital staff, doing some nursing jobs, they represent over 90% of all those jobs, and they represent 73% of all the cases of medical staff being infected with the coronavirus. On the other side, President Trump is signing today a new executive order suspending immigration to the U.S. for the next 60 days. He said that he might consider extending that suspension for a longer period, but he will see on the way. And his decision has been criticized by many sectors, not only Democrats, that says that has nothing to do the reasons why he's saying that, and they are calling him the xenophobic in chief. And in the case of one of the most conservative newspapers, we're talking about the Wall Street Journal, today there is an editorial of the Wall Street Journal saying that this is just a distraction, that the decision has nothing to do with safety and fighting the coronavirus pandemic, and also with security. It's just a political stunt. We get back to you now.
We thank our correspondent Jorge Gestoso for that report. In the U.S., citizens continue to take to the streets to protest against stay-at-home orders to prevent the spread of the novel coronavirus. In Richmond, Virginia, thousands gathered to demand the state be opened after U.S. President Donald Trump unveiled plans for a partial reopening of the economy. Amid an unemployment crisis, protesters have demanded the restart of the economical activities in the country, which continues to be the worst affected worldwide by COVID-19 pandemic.
We're not afraid of the virus at all. It's run its course. I already had the virus myself, and a lot of other people have also. And, we can't get infected again, and we want to reopen. We need money, we need food, we need to help our families out.
Protesting the shutdown. This is crazy. People are losing their jobs. They can't pay their rent. They can't buy groceries for their kids.
Authorities in China have once again condemned what they called conspiracy theories and false accusations spread by the U.S. government, while U.S. President Donald Trump has shown no sign of slowing down in fanning these flames.
China is a victim of COVID-19, not an accomplice, says Zheng Xuan, a spokesperson of China's foreign ministry, following the latest accusations made by U.S. President Donald Trump.
The virus is a common enemy of all humanity, and it can appear anywhere in the world. China, like most other nations, was a victim of the novel coronavirus. We are not accomplices.
China, along with the international community, have rejected the conspiracy theories and wild accusations without any scientific proof lobbied by the White House.
U.S. Senator Tom Cotton alleged the virus originated in Wuhan's Virology Institute. After this, the Washington Post and other outlets wrote about how the virus came from a lab in Wuhan. They have no evidence, nor any logical reason to make that statement. They say this based entirely on a speculation. There has been no evidence showing that the virus was man-made.
Beijing has criticized the doublespeak of some Western politicians and media outlets, reminding them that in years past, none of them has asked the United States to apologize or take responsibility for other crises.
During this global pandemic, the international community has to come together. There is no time to throw accusations or demand that someone takes responsibility. I cannot recall something like the happening in 2009 when the H1N1 flu exploded in the United States and then spread to 214 countries, killing almost 200,000 people. Did anybody ask the US to pay for this damage? In the 80s, the AIDS epidemic was first discovered in the US and it has now spread all over the world. How many millions are infected? Did anyone ask the US to pay for that?
The COVID-19 pandemic has caused over 182,000 deaths across the globe, most of them in the United States, Italy, Spain, and France. Still, conservative media outlets and President Trump continue to speculate about the origin of the virus and attack China, a strategy that, according to experts, does nothing to save lives, but only works to divert attention from the failures of the U.S. government.
Beijing, China. The UK's chief medical advisor has said that social distancing measures in the country may have to stay in place for the rest of the year, adding that the possibility of a vaccine or treatment against COVID-19 being considered this year is, quote, incredibly small.
In the long run, the exit from this is going to be one of two things, ideally, one of which is a highly effective vaccine, and there are a variety of ways vaccines can be deployed. They can be deployed for damping down epidemics, they can be deployed to protect vulnerable people, or highly effective drugs so that people stop dying of this disease even if they catch it, or which can prevent this disease in vulnerable people. Until we have those, and the probability of having those any time in the next calendar year are incredibly small, and I think we should be realistic about that, we're going to have to rely on other social measures, which of course are very socially disruptive, as everyone is finding at the moment. But until that point, that is what we will have to do, and it'll have to be the best combination that maximises the outlooks. But it's going to take a long time, and I think we need to be aware of that.
All over the world, experts are trying to discover a cure for the novel coronavirus, and in many countries, this has meant using the plasma from recovered patients to treat some of those who are in critical condition. Such is the case in the Philippines, where doctors say they are trying to harness the antibodies developed by recovered patients as a, quote, experimental drug.
Someone who has recovered from COVID-19 will have antibodies against the virus that causes COVID-19. So we harness that. We take advantage of that. So we ask our survivors, we call them survivors, COVID-19 survivors who have fully recovered from COVID-19, to donate their blood, specifically their plasma where the antibodies are.
Right there and then, when I was asked if I was willing to donate my plasma, I never had second thoughts to donate. So I immediately said yes. It's just a small contribution, doing my part to help other patients in my own way.
French government said on Wednesday that cafes and hotels may not be able to resume work on June 15th, over a month after France starts easing the strict lockdown restrictions.
Our ambition is to work together. We also need time to develop the various scenarios for business to resume, so I obviously cannot confirm the date of June 15. What I can tell you, however, is that we are aware of the particular difficulties facing this sector, which will not be able to resume its activity, as the President of the Republic has indicated, at the same time as the other economic sectors, and which, as such, will need special assistance. And that is why we are currently working in consultation with the sector to have a specific plan of support and assistance for hoteliers, cafe owners, and restaurant owners.
And with that, we've come to the end of this news brief. You can find these and many other stories on our website at telesurenglish.net. And be sure to follow us on social media. We are on Facebook, on Twitter, and on Instagram. For Telesur English, I am Estefania Bravo. Until next time.